My name is Bancroft McMurphy. I've been a practicing orthodontist here in Mobile since 2004. Inspiration for me becoming an orthodontist probably would start with my family and secondly, my personal experience with orthodontics. I come from a long line of dentists. This is actually a picture that was in the American Dental Association journal a long time ago, but my grandfather's picture on the wall, my great-grandfather's picture on the wall here, my grandfather, this is my father, he's a pediatric dentist. My uncle, an endodontist who is Stedman's father, and then my other uncle was a periodontist. I saw the lifestyle of dentist. I understood, kind of owning your own business and the advantages and disadvantages of that. I like structure in my life, and it is a very structured existence. So it appealed to me in all those ways. As my adult teeth were coming in, my canine teeth came in really out towards my lips, and it wasn't very attractive. My mom called them my fangs. So I was really ready to get that fixed. And when they started coming in when I was 12 or 13, plus that's a time in your life where like you begin to really care about how you look. And it was fixed, and there were no shots involved, and that was appealing to me. A process that achieved a result that I wanted, and it was fairly simple. I guess by the time I got into high school, I probably felt like either medicine or dentistry would be things I would be interested in doing. Got to college, I worked in a hospital for a couple of summers, and really just kind of determined that dentistry probably fit my skill set a little bit better. So I made the decision in college to apply to dental school. I was lucky enough to get into the University of Alabama Dental School in Birmingham. At that time, kind of started investigating, what if I wanted to specialize, and worked in an orthodontic practice for a couple of summers, and really had a great mentor. His name was John Morgan. He practiced on Old Shell Road. Like I said, I worked with him, did some research with him during this one summer, ultimately applied to orthodontic programs and got into the University of Pennsylvania, a dual program specializing in orthodontics and periodontics, which is specialty of treatment of gum tissue, basically. When I was in my residency, my mentor, Dr. John Morgan, passed away. But I obviously continued to study and work. I was there for 4 years. Really, everything worked out very nicely. I was fortunate to go in with Dr. Stephen Hicks into an existing practice. I think he had been practicing orthodontics for about 10 years at that time. He had just built this facility on University Boulevard, and he did an amazing job with that. So the facility was amazing. I learned a lot from him about orthodontic care, but also treating people, treating staff. I would attribute any skills I have in that to him, because he's very good at that.